What is anxiety? Anxiety is characterized by frequent and intrusive anxious thoughts about everyday life experiences for no obvious reason. It is the most common mental health disorder in the United States, and 19.1% of U.S. adults and 7% of kids aged 3 to 17 are affected by it. Anxiety as an emotion is something fleeting that all people experience from time to time, but anxiety from an anxiety disorder does not simply go away and can worsen over time. There are a few different types of anxiety. One of the most common types is called generalized anxiety disorder, which is when an individual displays symptoms of excessive worry on most days for at least 6 months at a time. The worries can be about anything, including academics, relationships, work, family, and social interactions. A few more common types of anxiety include panic disorders, various phobias, and social anxiety. Individuals with panic disorders experience recurrent unexpected panic attacks. A panic attack is a sudden period of intense fear that can reach its peak in minutes. It can be random and unrelated or caused by specific triggers. A phobia is an intense fear of something. It is usually irrational and disproportionate to the danger of the triggering subject. Some common phobias are centered around flying, spiders, snakes, and heights. Social anxiety is the fear of social situations and can be manifested as extreme dread surrounding activities like public speaking, stage performances, and more. If you think you, a friend, or family member may have anxiety, please consult your doctor for professional advice. Anxiety can be treated with psychotherapy, family therapy, medications, and/or behavioral treatments. Some stigmas associated with anxiety are that people believe that anxiety is not a real mental health problem, that it is a sign of weakness, or that all people with anxiety could get treatment if they wanted to. These are all false, seeing as mental health issues are just as real and valid as physical health issues. Just as we do not chastise people for suffering from cystic fibrosis or cancer, we cannot look down on people for suffering from anxiety or any other similar disorder. We are all humans at our core and deserve the same kindness and respect. We should always try to be diligent and present for our friends and family in case they wish for our support. If you have anxiety, you can help people support you by seeking support groups and talking to those you trust about your triggers and comfort zones. You can support others with anxiety by helping them avoid their triggers, creating a reassuring and non-judgmental safe space for them, and guiding them to receive medical attention when necessary. To conclude, so many of us have to cope with anxiety on a daily basis, which is surely not easy to do. But while anxiety is very much a real problem that requires care and conscious effort to manage, many people worldwide are able to live their lives happily and successfully in spite of its challenges. If you or one of your loved ones deal with anxiety, stay informed about the condition, seek professional help as needed, and keep the faith that you can still live a beautiful and emotionally rich life.